News and Talk 1380 WAOK.
A place where you get educated and entertained. We are your new hot spot. You are listening to Ask the Fat Doctors here on News and Talk 1380 WAOK. I am your host, T. Fox, joined here every week with one of Atlanta Falcons' fan favorites, Jamie Dukes.
Hey, what's happening?
And along with the good doctor, Braxton Cosby.
How you doing?
And the teddy bear is what I like to call him, Mr. Darren House. Hey. Good.
That's how
We are, yeah. Okay, good to have everybody with us, and thanks for joining us. We're going to have a great show. We got lined up. Our hot topic today is going to be Rianna and Chris Brown. How about that?
What about Rianna and Chris
Rianna
Brown?
and Chris Brown are back together.
Again?
I don't know how many people
I didn't know they were
want to know.
separated.
Yeah, well,
They were separated because one of them was in jail for a minute.
yeah, and one of them popped
But
the other one in the eye.
you know how they do when you go to jail now. They say they hold you down, so
Yeah.
you don't necessarily get separated.
Well, they were separated back together and whatever. And also, a musical icon is about to say I do. We're going to tell you who that's a little bit later in the show.
We got one with us, so...
We do.
He already did.
I don't know. I did. 20 years ago, I
was
did.
about to say.
Don't get him in trouble now.
He might have been doing it again.
Well, maybe.
Oh, that's true.
Right?
Could be
That's
20
right.
Yeah,
years.
That's
reunion
right.
is about
20
that
years.
time.
Yeah, but I said it once. That's all I need. I did
Okay.
it once.
Okay.
Yeah. Once is enough.
Once
I meant
is
it when
enough.
I said it 20 years ago.
And she
I
might
said
want to hear it again.
Well, yeah, we'll see about that.
Okay. And Dr. Terry Fullum, he's going to be joining us a bit later also in the show. And for all you Twitterers, is that what you call people that tweet? Tweeters?
Yeah.
Okay, for all you tweeters, hit us up at Ask the Fat Doctors or on Facebook. We'd love to hear from you, and we'll share your questions or comments live on the air. Now, Ask the Fat Doctors. Now, that's it's an interesting name of the show that we came up with. So why don't you, Jamie, tell everybody, Ask the Fat Doctors, what we're all about.
What it's about is that, you have a lot of people that don't understand we're killing ourselves with the fork. Mm-hmm. And it's manifesting itself in a multitude of ways. When you look at type 2 diabetes, heart disease, Dr. Cosby, you can speak to all of these different things. What people don't understand, various forms of breast, prostate cancer, is that excess weight is a contributing factor to all of these maladies. Type 2 diabetes, you can go down and down the list, heart disease. And so we want to make sure that everybody's informed and educated on what's going on. We're going to have a little fun in the process.
Well, and you know what? I just read earlier, and I think I shared it with you about obesity is a bigger health crisis globally now than hunger.
Wow.
I mean, across the continent. They saying that the Western lifestyle, which is, us big, what you call it when you go to McDonald's? Because I haven't been there forever. When you go to McDonald's and you're big.
Stop lying.
And
you
you're big,
just
lying. No, I have not.
Just stop.
You didn't pay for the meal you got there, but you've been there.
Well, I know you know people.
No, I have not gone to McDonald's.
Stop it.
I have
you're looking good now. I understand that.
Thank you.
Yeah.
Thank you.
Yeah.
Now, what is it called?
Supersizing?
Supersize it. Yeah.
You need to stop. Let's talk about Chris Brown and whatever the girl's name is, rehab on.
Yeah. See,
what's her name?
See, she's never been to rehab.
Yeah, no,
I didn't know
that's
what is her name. I didn't know what her name was. I don't listen. So what's going on?
Okay, so this is the thing. Rianna and Chris Brown are back together, and it is it's rumored that she's taking Chris to Barbados this New Year's Eve holiday, and they're supposed to be tying the knot.
Yeah, they're back together though. 'Cause he put a picture up on Instagram of the two of them. Actually, it was a pretty intimate picture. She was kissing him on the cheek. He put the picture on Instagram and took it down right away. But then somebody took a screenshot of the picture.
And
so
then retweeted it.
That's right. So
Wow,
too late,
man, too
Chris.
late.
I like it. You wasn't fast enough, doctor, because they
Yeah.
took us. That's this technology to get you.
And and then speaking of Chris, speaking of Chris and Rihanna, if they can work it out and get back together, I don't know. It's not for me to say if it's a good thing or a bad thing. I don't know.
Why?
But speaking of what you just said, you have to be careful about that tweeting and then taking it down and thinking that it's not going to be recovered. Chris documented his entire weed marathon. He just went on this
Really?
weed marathon, smoky marathon with his buddies and
Was
put
it
it
in
on
Colorado?
Instagram.
I was getting ready to say he must have
Yeah.
had a trip to the Smoky
To the Smoky Mountains.
Smoky Mountains is in the Tennessee.
He was smoking the mountain.
He was smoking the tree that grew out of the mountain. Yeah.
Yeah, I mean, it was just kind of crazy. So he put them up there, and they're still up there. And he's got a picture
Wow.
of himself with 3 joints.
So this is kind of like that Jane Goodall thing when she used to be with the gorillas and she documented it.
Right,
And this is
right.
supposed to teach somebody something, I'm assuming,
Now
right?
look at him.
It's-
There is Chris.
It
He's
is.
standing there with a blunt.
Well, he had 3 joints. He must not get a revelation about a blunt. You're supposed to put all 3 of them and make
my
one
gosh.
of them. I mean, why you?
I mean, totally. I mean, just totally insane. And the other couple things, actually, I guess is congratulations maybe in order to go out to Kim Kardashian, CeeLo Green, and Lady Gaga. All of them have something in common. All of them want to lose weight.
Really?
Yeah.
Well,
Kim Kardashian.
Yeah, Kim Kardashian.
Well, yeah,
said-
she goes up and down.
Yeah.
She goes up and down. And one of these days we're going to talk about the junk in the trunk.
In fact, we're going to talk about junk in the trunk in just a little bit with Dr. Terry Fullum. He's going to check in. He's going to check in with us in just a little bit. Okay, and in fact, we're going to check in with him in just a little bit. Don't forget, tweet us at AskTheFatDocs, and you can hit us up on Facebook. We'll be back in just a moment.
News and Talk 1380 WAOK.
Do you have questions about how to manage your weight problem? Do you just want to lose 20 pounds? Do you need to lose 100 pounds? I'm Dr. Braxton Cosby, and I want to tell you about AskTheFactDoctors.com. Log on and submit your excess weight-related questions, and we will guide you to the right weight management solution to get the job done. For those of you who are battling diseases like sleep apnea, breast and prostate cancer, type 2 diabetes, high blood pressure, and other comorbidities, the truth is, excess weight is in many cases a contributing factor. AskTheFatDoctors.com wants to help you. We've assembled an army of the best doctors in the world to get you the answers you need to get that weight off, which may be hampering your quality of life. At AskTheFatDoctors.com, privacy is our motto. Your questions will be submitted in a secure environment, and we will respond directly to you. You have our word on that. So log on to AskTheFatDoctors.com and find the solutions you need to get that excess weight off and fight the diseases of excess weight.
News and Talk 1380 WAOK.
And we are back here at Ask the Fact Doctors. I'm your host, T. Fox, along with Jamie Dukes, Dr. Braxton Cosby, Darwin Hobbs, and our special guest that's on the phone live with us is Dr. Terry Fullum, who is the Chief of Surgery at Howard University Hospital. Welcome, Dr. Fullum.
Thank you. It's great to be here.
Good. So, we were just talking before we went into the break about some folks that need to lose weight.
Sure.
They said
Now,
they
that wasn't what
wanted
we were
to.
talking about. We were talking about junk in the trunk,
Well,
and you had
kinda.
talked about, what's her name?
Well,
Kim, the girl that's got no talent.
Yeah, man, Kim Kardashian, right.
Yeah, the girl's got no talent
I
for whatever
see.
reason she's
And
famous.
I have no idea why she's a celebrity. She's a celebrity for doing what? But, we
For
won't get on
being- for
junk in the trunk?
Yeah.
For junk in the trunk.
The junk in the trunk. Well, she's pretty also. And, her family issues were something that made reality TV. I think they made almost $40 million last year as a family. So she's doing too badly.
Well,
I can't be
but
mad
that
at
doesn't
her.
mean you got talent.
Exactly.
I mean, there's a lot of
Right.
reality show people that don't have talent because
Right.
people are falling for dysfunction. But the point we're trying to get to, Dr. Fullum, is this question. Is junk in the trunk good or bad?
What?
Well, that depends on what you like, I think.
Well, it depends on if you had it injected in there. Is it genetic?
Yeah, and just how much junk is in the trunk. I mean, there was a song written about it, so it can be thought of as a very positive thing.
Let me rephrase
Certainly
that.
from a cultural perspective, I think that it's a good thing. From a health perspective, over a certain point, I think it can have a negative effect. Not quite as badly as a lot of junk around the middle. When you look at the hip, the waist hip ratios, more stomach fat versus more hip fat is probably a little bit more dangerous from a medical perspective.
I once read an article, Dr. Fullum, where he talked about that correlation between men and having bigger stomachs and the prevalence of coronary artery disease.
Yes,
Yeah, I
and
definitely
type
agree
2
on that.
diabetes.
Well, you know what, Doc, it's not just about the junk in the trunk. I know we were talking about, obviously, obesity has now eclipsed hunger as being the biggest health concern across the globe. not just in the United States, but across the globe, because so many other countries are adopting the Western lifestyle, which is doing things big.
Yeah.
And so we were talking about how obesity obviously leads to the other comorbidities that we have problems with health-wise.
Yeah, it certainly does. There's a direct correlation between increased weight and these health issues, hypertension, diabetes, joint disease, even cancer. Cancer of the breast, cancer of the uterus in women, cancer of the colon, prostate in men are all have a direct correlation with obesity.
We're talking to Dr. Terry Fullum, Chief of Surgery at Howard University Hospital. And Doc, let me ask you this, because I think that people don't quite understand how these, what we call the diseases of excess weight, actually tie and translate into problems down the road. Could you speak to that?
I can. Obesity is a disease that causes inflammation. It's an inflammatory disease. So at the organ level, at the cell level, you have inflammation, and inflammation causes has a negative impact on how the cells function, how the organs function, and so over a period of time, you have these comorbidities, if you will, these medical illnesses that develop. Hypertension, diabetes are two big ones that we talk about. Metabolic syndrome that can lead to coronary artery disease, can lead to heart attacks, can lead to strokes, can lead to cancer. And it's something that occurs over time, 25, 30 years, as we gain weight and become more overweight. This inflammatory condition starts to affect our organs in a negative manner. And that's the reason why eating properly, maintaining a good, healthy lifestyle, and watching your weight has become so important.
We're talking to Dr. Terry Fullum. And, Doc, let's talk about the ties to heart disease and how, if nothing else, what you would recommend. Because a lot of times, Darwin and I, we both had bariatric procedures, and we recognize that we have reduced our risk because of those, the procedures that we have had. Can you speak to that?
I can. So, weight loss surgery is for those who are, let's say, significantly overweight. So we talk about body mass index, and the body mass index normal being between 18 and 24.9, and overweight 25 to 30, and then class 1 obesity, class 2 obesity, class 3 obesity. And what that means in layman's terms is once you get about 100 pounds over your ideal body weight, this is when we start seeing a significant increase in these medical illnesses that lead to a lot of issues and problems that we've already mentioned. Now, those of us who want to lose weight, if you are trying to lose 10 pounds, 15, 20 pounds, then lifestyle changes, medical weight loss strategies, diet programs seem to be pretty effective. But if you need to lose 100 pounds or 150 pounds or 200 pounds, then medical programs are usually not successful long term. If your definition of success is I lose greater than 50% of the weight that I need to lose, and the medical illnesses go away, and I keep the weight off for 5 years, then weight loss surgery is successful about 85 to 90% of the time, whereas medical weight loss strategies are only successful about 1 to 2% of the time. So currently today, weight loss surgery is the only long-term effective weight loss for those who are significantly overweight, what we call morbidly obese.
Yeah, this is Darwin, doctor, and I'm so glad to hear you say what you just said, because it kind of brings credibility to what I tell people. I use the layman terms, and so I don't as eloquently say it like you just did, but I mean, Jesus, I want to get the transcript from what you just said, because I can use it moving forward, because I tell people all the time, I had gastric bypass surgery 6 months ago, and to date I've lost 114 pounds, but I
fantastic, congratulations.
Thank you very much. And my wife, she had a gastric sleeve, and she's lost 84 pounds. She had surgery 2 weeks after I have after I did. But I say to people all the time, after you reach a certain plateau of weight, people I have friends that are over 400 pounds, just like I was 426 going into surgery, and I tell people all the time, it seems that, this is me as a layman talking, it seems that after you crest that certain BMI or that certain weight, I just have, and me personally and Tracy, we tried everything. I've tried everything. And the only thing that so far, and I'm 44 years old, that has given us what we call more than just a 3-month success and more than, it's only been 6 months, but the only thing that has really, really, really caused us to exit that other paradigm of sickness and obesity has been this surgery. And I feel like after a certain point, then, as you have just said, after a certain BMI or after certain, then then to me, surgery is an amazing option for people. So I just didn't know that what I was saying, really was, there was credibility to it, but I was convinced of it. But I'm glad to hear you say what you just said.
Yeah, no, that's what we see, and that's the way we practice. When we have patients who come, we look and see what their body mass index is. We look at their medical illnesses. We look at what their personal goals are, because the weight loss surgery is certainly a great tool. It's very, very helpful. But I will tell you, long-term success is directly related to the ability of the individual to change habits, behavioral modification, lifestyle changes, and really look at life aggressively and wanting to be very active, wanting to exercise. And when I say exercise, and Jamie knows about this, we try to find things that are fun for our patient. Chachersize or bowling. I mean, for someone who doesn't exercise at all, walking is an exercise. For someone who doesn't exercise at all, golf is an exercise. So finding something that you enjoy so that you'll actually do it becomes very, very important. Understanding that you need to change your lifestyle and become more active, get away from the television, except for maybe football on Sundays. But other than that, get away from the television, and be outside and just go and do things that really require you to be active. I think everyone should wear a pedometer, and your goal should be to make 10,000 steps every day. And if you've done that, then there's a certain number of calories that you've burned, and it's really helpful, for the heart, even if you are just walking. So you don't necessarily have to run a marathon or get on a bike or, the P90X or insanity type of things. If you weigh 440 pounds, that's not going to be a successful long-term solution for you. But with weight loss surgery, an active lifestyle change, finding activities that you enjoy doing, particularly if you have a significant other or partner to look out for you and to work out with, and being very aggressive with your calorie counting, eating the right foods, finding how to cook properly. That's the whole lifestyle change that we're talking about. You can have not only short-term success but long-term success as well.
Dr. Fullum, as always, your advice has been priceless. Thank you so much for joining us, and make sure you make it a Merry Christmas.
And you do the same, T. Thank you so much for having me.
That's the Chief of Surgery from Howard University Hospital, Dr. Terry Fullum, joining us. We'll be back in just a moment. We're going to talk a little bit more with Darwin about his journey with weight loss. And we're also going to do HOP, which is Hold On Player. We'll do that after this.
News and Talk 1380, WAOK.
I'm Jamie Dukes, retired NFL player and current NFL Network analyst. The diseases of excess weight are taking a toll on the brown community, which includes African Americans, Mexican, Latino, and individuals of Asian descent. That's why the AARP's multicultural outreach is taking the lead to provide you with relevant tools like chachersize. The AARP is more than just discounts. Did you know the AARP has cutting-edge programs to help boomers take the first steps towards financial freedom? We can help you devise a strategy to manage your money, control your mortgage debt, control consumer debt, and give you the strategy to maintain healthy credit. Boomers, it's time to learn everything AARP has to offer. Log on to aarp.org and make that first step today.
News and Talk 1380, WAOK.
T. Fox back here with Ask the Fat Doctors, along with Jamie Dukes, Darwin Hobbs, and Dr. Braxton Cosby. Just quickly, we wanted to kind of come back from the break with Dr. Terry Fullum and talk a little bit with Darwin and some of the comorbidities that you actually experienced before you had your gastric bypass surgery. And you shared some of those with me.
Oh, absolutely.
Yeah, share some of those with I think it'd be interesting.
Yeah, well, which was the reason I made the decision to have surgery. Well, actually, I had lap band surgery 3 years ago, and I probably lost about 50 pounds. But to me, the problem with me with the lap band surgery is that also, which is another, I don't know if it's a comorbidity, but definitely I had horrible diseased joints. I had a hip joint that was diseased, knee problems, all that, and all directly related to obesity.
But you look good.
And,
You look great. You do.
Oh, thank you.
Awesome. No, I'm talking about you. You're always pretty.
Oh.
You're always pretty. With all that going on, you're always pretty. But go ahead. I'm sorry.
No, but I had the lap band surgery, and I probably lost about 50 to 60 pounds. I'd say, but I didn't maintain the weight loss because I wasn't moving. I was just sharing with Dr. Braxton here that. I wrote down here my ADLs, my activities of daily living have increased since having the surgery. Like I mean, just to walk, to where we're sitting now from the car. Usually I'd be like, where I get to the receptionist, I'm breathing hard, asking where I need to go and sweating.
Sure.
I used to carry a rag everywhere I would go because I sweat so.
What was that
profusely.
about you said ADLs? Is that what you call it?
Yeah, activities of daily living. That's walking and going to the shopping, and all the little stuff that we just do don't think about, but they provide you with exercise.
Pick up on that, Jamie.
Activities of daily living. I ain't gonna don't let me say something.
I think he's going activities of nightly living.
Right. I was getting ready to say, hey, nightly living. Amen. Well, you know what? That's increased too. Amen. Thank you, Lord.
It's profound what he's talking about, because even when I work with the geriatric population, people who get like a total knee surgery, but they've lived with this pain for about 5 to 8 years, and then they get the surgery to replace the knee, and then all of a sudden after they've gone through their rehab, they're expecting that same knee pain that they've been working with for the last 8 years, and it's gone.
Absolutely.
And so you get up and you start standing and you go, whoa, I'm supposed to be hurting. Oh, no, I'm not hurting anymore. So that's the same thing.
He's
Sounds
right.
very familiar.
What he's saying is right. I had my total hip replaced. So the day of your surgery, like they come in and want you to get out of the bed and walk down the hall. And I'm like, are you crazy? I just had my hip replaced. But you forget that the diseased joint, I got all new hardware. You're going to be sore because they've been digging around in there. But you can actually stand on that hip after the surgery.
And coming up on the new year, everyone talks about losing weight and getting into the exercise, into the swing of things.
Yes.
And when we come back next week for our show, we want to kind of drill down into some more things that you've
We're going to help them
experienced.
keep the New Year's resolution that they haven't been keeping.
Yeah.
And we're going to show them how, and we're going to show them where they can do it, and we're going to show them how it's going to be free for them. We're going to show them how they can actually do it online and access some stuff that will help them online. Dr. Cosby developed, we have chachersize. For those of you who don't know, go to chachersize.com and see what that is. And then C4, which Dr. Cosby developed. So we will set it up. If you really want to work next year.
C4, that's explosion.
Yeah, that's exactly what it is, the explosion.
Y'all trying to blow the people's weight up in here is what you're doing.
Blow it off.
Blow the fat up.
We're trying to blow it off.
We like a terrorist.
Not blow it up.
We blowing up.
Blowing up.
Now, also, this is this little fun segment we do at the end of the show is called Hold On Player. And that is when someone has done something totally insane that you have to stop dead in your tracks and say, hold on, you couldn't possibly be doing what you're doing. You got a hold on player?
Well, I do have a hold on player, but mine is a little different. Normally it's a lot of fun stuff, but this is my hold on player is for my friend Wiley Jackson. A lot of people are going to say what they have to say, and I will. There you go. I will say it like this. This man has done a lot of good in this community, and sometimes when you start venturing off into things that maybe you don't have an expertise in from the standpoint of a business opportunity or business transaction, sometimes you don't have your I's dotted and your T's crossed. And all I'm saying is before people start judging my friend, I just want people to understand this. Let's just look at the body of work, look at all the good things that he has done in this community, and look at all the lives that he has changed before you start judging, talking about a coin or two or something. And I'm not saying that anybody should be absolved from violating the law, but what I'm saying is for those who want to judge, I would just say that you're judging a good man who has done a lot of good in this community and who has made a mistake. That's my hold on player for all you players.
Amen.
That's the hold on player for this edition of Ask the Fat Doctors, and I think we'll wrap with that. How about that? I think we'll wrap with that. Merry Christmas to you guys. Make sure you make it a happy holiday. Okay? Alrighty. Okay. See you guys next week.
News and Talk 1380 WAOK.